Hello there. Good evening. So good to see you. I'm Mia Gradney. I'm back with another back to school Q&A session. Now, we have spent the last couple of weeks helping parents and students with back to school concerns and questions. HISD, the state's largest school district, heads back a week from today, August 23rd. We know, parents, you have plenty to ask. We've heard from you throughout the summer. Here now to answer your questions is new Houston Superintendent Millard House II. Good evening to you, sir, and thanks so much for being here.
Good evening, Mia, and thanks for having us.
So happy to do so. So let's dive right in, starting with mask. It is the number one question that we get from parents. HISD, as we understand it, has defied the governor's executive order banning masks and has imposed its own mask mandate. Explain for us, what does this mean for students, staff, and anyone who is on an HISD campus?
Mia, the mask mandate is fairly simple. It simply means that masks will be required of all of our students, staff, and visitors that come on our campus. It means that it needs to be worn not only over the nose, but also over the mouth. Also means that it needs to be worn, that is masked, on our school buses as well. Now, with the mask, there are some exceptions, and those exceptions really have to do with medical exemption. So if there's someone or student or staff member that can't wear a mask, they can provide a doctor's note that essentially lets us know why they can't wear that mask, and that exception will be honored in that particular instance. So we know this has been a hot topic. We really, our focus has really not been on defying the governor, or our focus has really been on data and what the data's told us. You know, a couple weeks ago, we were looking at a 500% increase, Mia, in terms of hospitalizations in Harris County. We also know that 6 weeks ago, we were close to a 4% community spread over 14 days, and we're now looking at close to a 20% community spread data point, and that's something that's concerned us. So again, it hasn't been that we've looked to defy city or state government. It's really because we want to protect and do what we feel is in the best interest of community health and mitigate.
This was a move out of a concern of safety, is what you're saying.
Absolutely.
And you're firm on mask, but what if the Texas Supreme Court overturns the mask mandate? Will HISD violate orders and at that level and continue with its mask mandate?
Of course, we'll consult with legal teams, and of course, I'm not an attorney, but we'll consult and do what's in the best interest of us as an organization when it's all said and done, and the best interest of our community as well. So we'll let the attorneys handle all of the legal jargon and what that looks like, and we'll acquiesce around what's best.
We know there's staff back on campus now. So is the mask mandate effective today or at the start of school?
The idea was to move forward when school starts, but we've strongly encouraged since we instituted the mask mandate that would go into effect on the 23rd. So we're actually wearing masks in our building at central office already. Of course, teachers are back, and our expectation is for them to wear masks in the building as well. But overall, for students, it will go into effect, of course, on the 23rd.
And how long do you foresee this mask mandate being in place?
Hopefully, as short a time as possible. I really wish I had a time machine or a magic wand to say it's going to be this particular date. But the reason we put it on because the data is telling us something that we should really be concerned about. So we'll continue to watch that data, and we'll focus on the data going in the right direction. What we also know, Mia, is that we can get samples of the sewage water to find out what direction that this thing is heading. And unfortunately, it tells us over the next 3 to 4 weeks that the data is going in the wrong direction. So hopefully, once we get to the peak of this spike and start heading in the right direction, we'll see some some good days in front of us and hopefully sunset this mask order as quick as possible.
Give us a better understanding or idea of this data that the school district is tracking. I know you mentioned the wastewater, and for people who aren't familiar with that, that's basically the testing of the wastewater to see what level of COVID is there. But what other type of information and data is HISD following?
The community spread data is extremely important. It's very telling. Also, of course, our county judge made a strong determination. You know, when I moved into this county, like I said, 6 weeks ago, we were at yellow, and of course we have a yellow, a green, yellow, and red warning meter or whatnot, and we've moved all the way into the red. So the community spread data, of course, the sewage water information, indicators that you talked about, all of those are important indicators as we look towards the future and make this kind of determination.
Superintendent House, I want to get to a question from one of our viewers. Erica Barrera asked, why don't you give us a virtual option?
So when we talk about virtual in HISD, HISD is one of the only school systems in the state of Texas that was grandfathered in terms of virtual. We have a virtual option. That is a partner school. It's called Texas Connections Academy, and we've had it for quite some time. There are about 8,000 kids in Texas Connections Academy. We're looking to expand that by an additional couple thousand kids. On top of that, we have moved forward with the development of a temporary online learning platform, but this is more specifically for those students that have to quarantine or end up coming down with some type of communicable disease. And the idea here is that they can engage in up to 20 days of temporary online in this platform. Students are participating in this option must engage in synchronous instruction for at least 4 hours a day. And that was something that was set aside by TEA a couple weeks ago. So their normal teacher that they have in the classroom in person will not be the teacher that will engage with students during this particular time. So we've got a couple different pieces. One is for those students, again, that are quarantined or have to be excluded from classrooms, and the other is a partnership school with Texas Connections Academy that we've had for quite some time.
So 20 days offered of virtual schooling for those students who are not able to participate in the classroom due to quarantine or some other sickness or illness. Okay, another question, and a lot of people asking, what if a student or parent chooses to challenge the district-imposed mask mandate? Danielle Young asked, what is the protocol for kids that refuse to wear a mask?
So for staff and students, non-compliance with the mask mandate in the school system will face some, for staff, will face some disciplinary actions. The first occurrence for staff will result in an employee being sent home. Afterwards, any non-compliance with a staff member will mean that there will be additional disciplinary. When we talk about students in particular, what we would do in that instance is that we would actually separate the student from their class. If they're choosing not to wear a mask, we would find a place, either a separate classroom where they're not around other students, and they would actually be there until contact is made with the parent. If there's non-compliance at that particular juncture, what we would do is move the child into the temporary online learning platform that I told you about that can be utilized for 20 days. So staff, student, kind of two different approaches. The last thing that we want is any major issues. We want to educate our students. We want to be back in person. We just want to do it safely.
I understand. So no disciplinary action, however, for students who don't follow the mask mandate is what it sounds like, but I don't want to assume anything.
Yeah, I wouldn't say no disciplinary because, ending up at home in temporary status is not necessarily where you want to be. If you're a student that's in person, you want to be in person. You want to be in front of a highly qualified teacher face to face. But what we're trying to do is really find the best of both worlds and ensure that the student learning can continue.
It's a challenging balance. It is. Mary Woodward Smith asks, have you considered delaying the start date for school? Are you keeping an eye on Houston schools that started today? And do you have plans to revise the start date if there are outbreaks in schools? Let's take this one by one because it was a lot from Mary. And thank you, Mary. First question, have you considered delaying the start date for school?
We have not considered. We're looking forward to kicking things off on August the 23rd. Mary's second question was, have we stayed in contact with other school districts to find out what they're doing and how things are going? And the answer to that question is yes. We actually have a listserv where we're communicating on a daily basis around different things, superintendents that is, in the area, and it's been very helpful to get insights. I also pick up the phone and see how things are going with some of my fellow superintendents across the state also.
Her last question, I think you summed up and answered. She asked, will you revise the start date if there are outbreaks in schools? Sounds like no, we're continuing with the start date being August 23rd.
If there are outbreaks in particular schools, and we will have situations, we'll look at those on a case-by-case basis. Example, there very well could be a case at a middle school, and example, if that middle school, we have to do the contact tracing to determine whether we need to shut down that classroom for a couple of days, whether we need to shut down that wing of that building, whether it's the cafeteria but the contact tracing has to be done to determine how big of an issue it is and what steps we need to take in order to ensure that everyone's safe in that particular situation.
Superintendent House, we are receiving questions about contact tracing. Alan Guzman asked, any contact tracing?
We have chosen the route of contact tracing, and that contact tracing will include assigned seats in our classrooms, assigned seats on our buses. And what that does is that if you have a positive case, you'll know exactly who was sitting where and who spent more than 15 minutes around that particular positive case, so that you can accurately, or as close to accurately, know exactly who needs to be excluded or who needs to be quarantined. So it is, of course, a lot of extra work for our administrators, our nurses, teachers to focus their effort on, especially our nurses. But we feel it's necessary. We feel that parents deserve to have that information, and we're looking forward to ensuring that we can provide that information when needed.
This is a piggyback question. Sounds like we've answered it in one, though. Shasha Boyd Smith, will parents be informed when there is a COVID case at a school? That is a form of contact tracing, correct?
Yes. So again, when there is a positive case and a child or adult teacher has been contact traced, we will let those involved know. We also will be continuing with our district-wide dashboard, and the dashboard explains how many cases that we've had at particular schools. We want to be transparent. We want to let people know what's going on. So between the contact tracing, the dashboard, we think those items will be extremely helpful to ensure that our parents are in the know.
A couple of people are asking the same question, different variations. Rita Martinez asks, what about special education kids? And then Antoinette Norris Woodson asks, what about medically fragile teachers and staff? So what about those with special needs, both students and those who are staff members?
Of course, there's a wide array of different students, special needs, exceptions from a medical standpoint for staff. And what I can say, those are being handled on a case-by-case situation. We very well could have a scenario where, a teacher cannot work in a classroom because they're, immune compromised. And we look at those situations individually. And it may be that a teacher like that, we may be able to utilize them in our temporary online learning. Student-wise, it really depends. If a student can't be in the classroom because of being medically compromised in terms of their immune system, then we'll work closely with that family to ensure that the special services are provided regardless of whether they're inside of the school building or not.
Another question, Danielle Young asked, are you keeping records of those that are vaccinated?
So vaccines are a part of the medical file, and they're private. So legally, it's not something that we can do. As you've seen, there have been some states that have stepped in and said, you know, all employees, I believe there have been a couple school districts in California, in Nevada, I think Clark County in Nevada stepped in and said, you know, everyone is to be vaccinated. If you're not vaccinated, you are to be tested periodically. That's not where we are as a school system. We feel that, you know, the vaccination records and any other medical records are not a part of school business. Now, it could be that the federal government or the state comes back and thinks differently, but that's not where we are currently.
Let's get back to the day-to-day activities within schools and other HISD facilities. Will there be daily health screenings for students?
So what we're doing at the elementary level specifically, and I say the elementary level because we know that vaccines are only available for 12-year-old students or 12-year-old children and up. So because of that fact, we're going to be doing temperature checks for elementary schools. Those that are not in elementary school, we'll ask parents to do self-checks or do their own checks before coming into our facilities. If they have a fever or any other of the 26, 27 different symptoms that are out there that are COVID related, then we'll ask that they stay home. So again, at the secondary level, middle school and high school, there will not be daily temperature checks. But at the elementary level, where students cannot be vaccinated, we have chosen to move forward and do so.
And I assume the district found that those worked from last year when done.
You know, there's a lot of research out there. Some have said that it's helpful. Some have said that it's not helpful. But I think whether it's because of a peace of mind, a piece of data, we've chosen to do it, like I said, at the elementary level. And until we hear otherwise in reference to research telling us that it's not a good practice, or it's a practice that doesn't work, or it's a practice for naught, we'll continue.
Now, once inside the school building, parents want to know what that scenario will look like. Alicia Ducart asking, how will the kids be in class this year? Are they still going to be 6 feet apart? Are kids with mask or without mask going to be separated from each other?
So, of course, as I mentioned earlier, if a student does not have masks, they'll be removed from that particular classroom and separated in a room essentially segregated specifically for students that have chosen to not wear their masks. But in terms of 6 feet or 3 feet, in reference to CDC standards or American Academy of Pediatrics standards, what I can say is that we're definitely going to do our best, but not in all situations are we going to be able to provide that space. What I can tell you is that all of our school buildings are going to be cleaned, disinfected and fogged with static electric foggers every night. We're also using hospital grade products as a precautionary measure. Schools and offices are all going to be provided, of course, with hand sanitizer, soap, the kind of tissue, and different disinfectant as well. Schools have the ability, as well as a separate fund that they can purchase additional items as needed. Our air ventilation systems, Mia, are going to be inspected regularly with repairs prioritized as needed. We're utilizing the highest grade filters that we can use. We're also reinstituting our high touch cleaning, which simply means all the surfaces like door handles, restroom light switches, where we know children and adults are touching on a daily basis. That will continue. We'll also use plexiglass dividers where applicable. We're moving forward. That first question, to dive back into it again, physical distance is no longer required, of course, but it's going to be highly encouraged when space is not allowing for it.
A follow-up question now from Maria Torres. Maria asks, what about young children who cannot get vaccinated and who will be piled in the cafeteria with several other classes? Is eating lunch in the classroom an option for a period of time?
It's a great question, and it's something that we explored. Great question. So we'll be doing breakfast in the classroom, but we don't have the manpower and resources to be able to do lunch in the classroom. It takes being able to cover the food, bring the food to each classroom. And if you think about the number of classrooms that occurs, it just wasn't feasible for us to be able to do. So we will be doing breakfast in the classroom, but not lunch in the classroom. We will have specific measures in our cafeterias, whether that's some will do every other seat, some will do students facing in all the same direction, but we are taking some mitigation strategies that we'll focus on for our cafeterias also.
There are those challenges there too. You're limited to space, and we're talking about most students now returning to the classroom, unlike last year where parents had the choice.
That's correct. It's been interesting. I had a chance to live it out last school year as a superintendent in a school district in Tennessee, where 60% of our kids were in person the first semester, and second semester about 80% into the school year. So we had a chance to see what this looks like. Of course, we know the variant spreads quicker, so that piece of it will be very important for us to pay close attention to. We had mentioned earlier really staying in contact with our area superintendents in the Harris County to ensure that we're all communicating, learning together, doing our best to mitigate the spread of COVID-19 and the variant, and make certain that the kind of learning takes place that we know our kids are missing. And it's not just about the learning. One of the things that I really want to make a lot of our parents aware of is that we're going to be focused on some social and emotional measures as well. We know that our kids have struggled emotionally because of this trauma and them missing that social interaction. So we've developed a plan to be able to provide a wraparound specialist at each one of our sites, counselors, social workers, to really help not only our students, but our families as a whole, really deal with what our students have dealt with over the course of the last 18 months. So lots of support, not just academically, but also socially and emotionally as well.
Students get so much from school outside of the classroom. Many students look forward to their extracurricular activities just as much, if not even more so sometimes, than the classroom. So questions there. Danielle Young asking, will you allow sports activities?
We have decided to move forward with sports activities. We think it's important. We feel like we can do it safely. We are limiting the occupancy in our sporting events, and our occupancy will be limited to about 50%. That I hope that answers your question.
Limited occupancy, and then what about mask at sporting events as well too, and extracurricular activities?
Great question, and I'm sorry that I missed that clarification. Inside of any of our athletic events, the expectation will be for our spectators to wear masks. If it's a outside event like football or some of the other outdoor track, and hopefully, of course, by the time track comes comes around, hopefully we're not still dealing with COVID and the variant, but specifically with football being outdoors, we're not requiring masks, but we are highly encouraging masks at those events.
Danielle Young asks, getting back to more viewer questions, who do we report to when the school, our kid, isn't following COVID-19 protocol? I think by that perhaps they mean that, they intend for their child to follow COVID protocol, perhaps wear a mask, and they're not. Are teachers helping enforce that just as much as other school leaders?
So, of course, teachers will be the first line of communication when there's a breach of the expectation. Teachers, of course, would be in touch with administrators. Administrators would take on responsibility of dealing with that particular case.
We know, Superintendent House, that people have been joining us throughout the evening, so forgive me if I have a repeat question here, but Mary Woodard Smith asked a question that a lot of people have posed. She says, please give us an idea of what your daily communications are like with our medical community, and how do their current hospital capacity levels affect your decisions regarding in-person school? Who are you in contact with from the local medical community?
I've been in touch as even today with Texas Children's Hospital, of course, our county judge, our county health department. All of these entities provide great insight. And the second question was, does the increase in hospitalizations and the increase in hospital or the decrease in hospital beds being available, does it affect what we do as a school system? And all of the above makes a difference. We pay attention to it all. It's very important. UMMC is another data piece that we've paid close attention to as well. So not one singular piece of data is the only piece of data that we listen to. Not one single organization is the only organization that we focus our efforts in paying attention to either. It's all of the above, and I think it's important that we continue to do so.
Another issue we addressed earlier, but people are asking about, Leah Vanderbilt asked, what will you do if the mask mandate is overturned by the Supreme Court? Will virtual school be offered?
So right now, the only virtual option that we'll be providing is through Texas Connections, as I indicated. We have about 8,000 students. We're looking to increase that by another 2,000 students. The mask mandate, regardless of kind of where it lands in the courts, it could be 2 months, 6 months, a year down the road before that's actually rectified. From what I'm learning from attorneys, this could be a long road, but we'll see. But the last thing that we want to do is to get into a back and forth with our governor at all. That's not why we're in this. I think at the end of the day, both the governor, the Texas Education Agency, we all want the same thing. We want kids learning. We want kids safe. None of us want COVID. None of us want to wear masks. I'm sending my children into classrooms. One of my kids can't be vaccinated. He's too young. So it's just personal as well. I would much rather not be in a situation where we felt that we needed to require masks at this juncture.
I understand. If COVID numbers rise and the pandemic worsens, is the district prepared to pivot and once again step away and do its own thing in regard to virtual learning?
We'll always have to be on the lookout for the unknown, and if we happen to get into that situation, we'll be prepared.
You talked about earlier dealing with the social as well as behavioral aspect for students, easing their anxiety. What do you want to tell the moms, the dads, the students themselves out there tonight about embarking on this most unique school year?
It's, all of us are having some of the same feelings. I spoke with a city councilor this past weekend who's, I believe, sending a kindergarten grandchild back into our classrooms. And what I told her is what I would tell anybody in our community. We're doing everything that we can to mitigate the spread of COVID-19 and the variant. We feel like that inside of our buildings will be safer than the community at large. As I indicated earlier, during the height of the pandemic in November and December, schools across the country where we're seeing significantly lower spreads of COVID-19. Example, the height of the pandemic, we were seeing about 24% nationally. And in schools, you were seeing about 4 or 5%. So it was a significantly lower spread rate. And that was simply because in most school districts across the country at that particular time, there were mask mandates, there were mitigation measures. And those are the same things that we have decided to start the school year with. So we're looking forward to a strong start to the school year. By no means am I promising that it will be perfect, but I am promising that we're going to do our best to ensure that we have the safest classrooms that we can make in HISD, and that we're going to do the best job that we can to support our children academically and socially and emotionally.
We know that health leaders have said the best way to fight COVID and to prevent it is to get a vaccine. Any idea how many are vaccinated within HISD?
We don't, much like we talked about earlier in terms of, vaccines and asking people to get vaccinated. Those are things that medically we can't necessarily ask. There could be the possibility of, randomized surveys that can be done. Right now, the focus is simply letting our parents know, letting our students that are of age know that we're a part of Super Saturdays. And of course, if you don't know what Super Saturdays are, they're in conjunction with the city of Houston. Mayor Sylvester Turner is leading the way to partner with several school districts. And this past Saturday, I had a chance to be a part of a not only school supply drive, but also a drive to get as many students, staff, community members vaccinated as well. We don't ask the question, but we make it available.
Understandably, and people can find out more information about those massive vaccination clinics on the HISD website as well too. One last question. It is the question we've gotten over and over again. Are you prepared for yet another challenge if the Texas Supreme Court decides to go in a different direction and doesn't allow you to require this mask mandate of HISD?
We'll do whatever's in the best interest of our students. At the same time, we'll also consult with our legal teams when needed be. That's the part of this that we really hate, that this is, has turned into, and we haven't been contacted by the governor's office or the Supreme Court. So we're listening and paying attention, but at the same time, we want to be as safe as possible. So we'll see what happens.
For now, your focus is on the students and next Monday.
That's correct. We're looking forward to a solid start. What I will say, Mia, before we close out, is if parents have not had an opportunity to see our Ready, Set, Go plan, many of the things that I've shared and most of the items that I've shared this evening are documented and memorialized in our Ready, Set, Go plan. You can find it on our website. It's very detailed in what the expectations are from mitigation to our strategies around learning, temporary learning for students that have to be quarantined. Everything we've tried to be as extremely thoughtful as possible to ensure that we provided our community, parents, and students with as much insight and information as possible.
Superintendent Millard House, thank you for answering all of tonight's questions. We appreciate you taking the time to join us. We're wishing you and all the students, teachers, and staff at HISD a safe and productive school year. Folks, if you missed out on some of tonight's questions with the superintendent, be sure to join us tonight at 10 for a quick recap. Thank you again, Superintendent House, and everyone else. I'll see you back here at 10.
Thanks, Mia.